Welcome back to Great Day. Are you overdue for your doctor's appointment? Have you rationalized why you're having certain symptoms? Our next guest ignored what her body was trying to tell her. Turns out the symptoms were a result of cervical cancer. Today, she is cancer-free, that's an amen, but wants to make sure no one waits as long as she did to get checked out. Please welcome Trisia Ann Herd, and she's back with Dr. Lavanya Palavalli-Parsons, a oncologist with UT Physicians. All right. This is so what a lot of us do. We get so busy, and we really showed up at the doctor's office when we know we're in crisis mode, right? Okay, what was going on with you?
Well, I just chalked my symptoms up to having a period all the time and cramps. And then finally one day I woke up and I had pain so bad that I couldn't do anything. And went into the ER and they found kidney stones. And so from there I had an infection that they couldn't figure out for about 5-6 weeks, and I went to a urologist and he found a tumor once he did a scope of my bladder and my intestine or my kidneys, and that's when we found the tumor and found out that it was cancer.
Wow. So. Okay. Dr. Parsons, recently there's been some changes in terms of when women should get a pap smear, but I think sometimes we're confusing that you may get your pap smear at a different time, but you should still go in every year.
Yeah.
So explain
that to
us.
So, traditionally pap smears were every year. You went in to your GYN doctor and you got a pap smear every year. But guidelines have changed. With the addition of pap smears, we are doing also co-testing with the human papilloma virus, or HPV. So there's certain high-risk strains of HPV that actually cause cervical cancer. So now we're saying you only need a pap smear starting at the age of 21 every 3 years. Now, women that are 30 years and older will get a pap smear and an HPV test at the same time. And depending on guidelines and those results and how you do that combination, you can get a pap smear with the HPV test every 3 years or every 5 years. But that doesn't eliminate you going to the GYN doctor and getting your annual exam, including a pelvic exam.
In her case, had she gone that and gotten that annual exam and had gotten that pelvic exam, would that have been found?
Absolutely.
Okay.
Absolutely.
Yes.
So the good thing is, with these screening tests, you can potentially catch cervical cancer really early, okay? Greater than 50% of the women that have cervical cancer didn't get routine screening.
Yeah.
Okay? And so when you go in for your pap smears, it's an excellent method to screen for cervical cancer.
Yeah. At one time, there was the most common cancer death among women, but this is an example of one of those ones that we can, kind of keep away or at least treat easier if you get in early.
Yeah.
Okay, so the kidney stones moment, I'm sure you were like, oh, okay, good, just kidney stones.
Right.
But then when you hear you have cancer.
I wasn't really shocked, actually, because I just kind of had a feeling, for a long time, and I was just scared to go get checked.
Right.
And so I just thought, okay, then let's do what we need to do to get it done, and kept positive throughout the whole thing. And I think with all the prayers and everything, that's a lot to do with getting through something like this.
But with that said, there's somebody else out there right now, and they're like, something's wrong, something's different, I'll get to it later.
Yeah.
Or as you said, you chalked it up to premenopause or whatever. And so there's somebody out there who's got something, and they don't want to go in. It's kind of like the same thing with when people go in for their mammograms, like, I don't want to know. It's like, well, it's coming whether you like it or not. You want to get it early or not, right? That really changes kind of your outcome.
I mean, she had exact symptoms our cervical cancer patients have. Abnormal bleeding, bleeding after intercourse, vaginal discharge. And in advanced cervical cancer, you can also have pain. Yeah. Pelvic pain, pain radiating down your legs, bladder problems, renal bowel problems. Yeah. So it's a combination. She had everything.
And here's the problem. I think we still, as women, don't want to talk about it. No. Especially in that part of our body. If you had a broken arm, you would have been in and had it taken care of. And we kind of want to put it in the back of our mind. But what do you have to say to that person out there who knows that something's not quite right, but is too scared to go in?
They just need to go in. I was scared to death for years to go in, and it's a simple process. And not painful, just better to know than not to know and end up like me.
Yeah.
So,
what was your treatment like? What did you go through?
I went through 5 days of radiation, and once a week I had chemo, and then I qualified for a trial and went into that and had chemo once every 24 days. And so my treatment started in February of 2016, and I was finished July 1st of 2016, so it was very quick.
Yeah. All right. You mentioned the human papillomavirus, and we know there's some controversy around the vaccine, and I think some people just don't quite understand it. But tell us about that vaccine and what it's meant to do.
So, vaccine is a buzz topic in the media already. So, the human papillomavirus, or HPV vaccination, came out in the early 2000s. It was to prevent the acquisition of HPV. So if you prevent the infection of HPV, you can prevent cervical cancer, which causes 99% of all cervical cancers. So why can't we eradicate it? So it was initially approved for boys and girls, boys included, from 9 to 26 years old. But just recently, in the fall of 2018, we have approved it, or the FDA has approved it, to the age of 45. So all those people that did not get the vaccination because they missed the age cutoff, please go get your vaccination. Even if you've had cervical dysplasia or HPV infections, you should still get it because you can prevent other types of HPV infections.
So why 9 to 45? Like if you're 46-year-old, like you're not doing it anymore, or what's the deal? I'm just throwing out there what I know some of y'all are thinking, well, wait a minute, why can't I get it too? Because I'm still doing things,
Absolutely.
right?
So the purpose of the vaccination was actually to give it before sexual debut.
Right.
Okay. So it's actually recommended for at age 11 to 12. Okay, but that doesn't mean you can potentially prevent it. Okay, so you can still get it despite you having sexual intercourse or been infected. It still can prevent HPV infections. And let me tell you, it's sexually transmitted. So most women in their lifetime have gotten HPV infections. It's usually a transient infection, it goes away, but if it persists, you get precancerous cells that can turn into cervical cancer if not treated.
And that's where I think the kind of rubber meets the road, if you will, is that a lot of parents are going, they heard the word sexually transmitted, and they went like this, and it's like, protect your child for the future. It's not about sex, it's about protecting your child.
And you know, this is one of the few cancers that can actually be eradicated, absolutely taken off this planet. Australia is actually set to be one of the first nations or countries worldwide to eradicate HPV and cervical cancer because of their vaccination program.
That's amazing.
And listen to this. This statistic just came out. 16% only get vaccinated by the age of 13 in our country. 16%.
Yeah, I took my son in. Okay. How are you doing today?
Good.
We saw you earlier where you went through your process of losing your hair, and then today you're actually messing with your hair, going, and I'm like, but you have hair to mess with, right? So congratulations, and thank you for that message to others out there. If you have questions about the HPV vaccine or want information about cervical cancer, don't hesitate to call UT Physicians at 888-4UT-DOCS, 888-4UT-DOCS, or visit them online at utphysicians.com.